Naš sljedeći predavač je profesor Markku Partinen koji dolazi iz Finske i on će danas govoriti malo više o sličnosti između EMEA, CFS i long COVID-a.
So, thank you very much for inviting me here, and we have heard very nice talks, and I think I understood something from Ina's talk as well. We have a wedding. I have wedding here where I live, and the bride is a Serbian woman, Tatiana, and we are going to have a weddings outdoors. So we are looking for some Serbian music. Perhaps you can.
Oh, excellent!
Excellent.
Yes. Say hello to Tatiana from us from Serbia.
I will. So similarities between ME and long COVID. So long COVID, of course, is something that we have noticed now during the pandemic, that not all patients recover after COVID-19. October 2021, WHO had a criteria or published criteria for long COVID. And they are here so that the patient must have had either a confirmed COVID-19 or probable COVID-19 infection. And then within 3 months from the onset of COVID-19, they develop symptoms that last for at least 2 months. Now, if we compare this to the ME CFS criteria, in ME, the duration in the criteria is usually 6 months. This is something that in the future we must also discuss, that should we shorten the delay from onset of fatigue and other symptoms from 6 months to a shorter period perhaps. Now, if we look for different symptoms that patients with long COVID have, so they have a lot of different symptoms, more than 240. This is from a paper published in Nature 2021, and as you can see, there are really many symptoms. Some of them are difficult to know that what is the etiology or pathophysiology. But here you can see that fatigue is the most common, but then they also have many other symptoms. This is from a nice study published in Journal of Neurological Sciences this year, where they looked for differences between patients who had been hospitalized because of COVID-19 and patients who had not been hospitalized, so with milder forms. And now if you look for comorbidities, different comorbidities such as diabetes mellitus or arterial hypertension were more common in patients who had been hospitalized. But if you look, for example, for neurological symptoms of long COVID, they actually are more common among patients who had not been hospitalized. Also, anxiety, depression, post-traumatic stress disorder symptoms, and sleep disturbances are more common in those who had not been hospitalized. This, in a way, is important to notice, because those patients who had been hospitalized, many of them have organ destruction, like pulmonary fibrosis and so on. And they actually have a disease called PICS, or post-intensive care syndrome, which is really a different from normal ME, most probably. We are conducting a large international study called International COVID Sleep Study, where we have now 16 countries participating. And when we look for symptoms of long COVID in order of frequency on an average, depending of the severity of the COVID-19, if we look at the red bars, we can see that fatigue cognitive symptoms, PEM, post-exertional malaise, excessive daytime sleepiness, pains, and shortness of breath are the most common. But if we look at those who had mild COVID or moderate COVID, the most common symptoms are fatigue, sleep, insomnia, sleep disorders, cognitive symptoms, PEM, and excessive daytime sleepiness, and then you have many other symptoms. So something that we have noticed here is that not only difficulties falling asleep and difficulties sleeping, but also excessive daytime sleepiness, being sleepy and sleeping a lot, and that the need to sleep is increased, is among the most common symptoms. Why this is not mentioned in many other publications is probably because nobody has asked for sleepiness. So if you don't ask, of course, you don't find it. So here we can see the IOM, which is now called National Academy of Medicine criteria for EMEA CFS. We heard this already shortly from Friðbjörn Sigurdsson and especially from Amolak Bansal's presentation, so I'm not going to that. But now if we look for different diagnostic criteria, and if we look at the criteria for ME, and we also take the criteria or the most common symptoms of long COVID, they are almost the same. Especially if we take, for example, the international consensus criteria for ME, or if we take the IOM or National Institute of Medicine criteria, most symptoms, the most common symptoms of long fatigue are included in those criteria. So in principle, we could perhaps use the ME criteria also in diagnostics of long COVID, at least to find those who have ME and long COVID. For the pathophysiology, I just refer what we already heard from Friðbjörn. So there are a lot of different or many different hypotheses, and also there is evidence for all of these theories that you can see in these slides. The cytokine theories, energy theory, mitochondria theory are among the most strong theories. Brain neurological symptoms are common, and they are also causing invalidity. And on that, it now seems that it may be especially an inflammation of the glial cells, which is the reason. I just saw some figures. Amolak mentioned about the investigations. Here you can see some other issues that we find in patients with long COVID. We also find similarity, such findings in ME. This is a patient with a marked dermographia, positive Darrier sign, which is due to mast cell activation. So mast cell activation has also been noticed in some patients with long COVID, as well as in some patients with ME. Amolak also mentioned the joint hypermobility, which is increasing the susceptibility to develop ME, and it seems that joint hypermobility is also increasing the risk of developing long COVID for different reasons that we don't know, but probably one is that the permeability of the blood-brain barrier is increased in these subjects. If we look at the different diagnostic criteria and we compare the criteria and symptoms of long COVID to those with ME, they are actually the same. Of course, we don't yet know exactly how many patients develop ME due to coronavirus, and what has been the incidence of ME during the COVID pandemics. we will find these figures pretty soon, and these probably are also the same as for long COVID, or at least 50% of the incidence of long COVID. So what is the incidence of ME CFS in patients with after COVID-19 and in patients with long COVID? This is a nice study by Komarov and Lucinda Bateman from the US. And the estimations are that around 10% of patients with long COVID may develop ME CFS. So there are many studies giving this figure. What does it mean? It means that if the probability of long COVID is around 10% of those with COVID-19, and then 10% of long COVID would develop ME, it would mean that around 1% of those with COVID-19 could develop ME. So what does it mean in different populations? In the world, it would mean that probably around 5 million cases of ME. In the US, probably more than 800,000 cases of ME. In the UK, 200,000. In Finland, probably 10,000 or more. And when I look for the Serbian, I suppose that the population in Serbia is around 6.9 million. And if from that population around 1.5 million or 2 million cases of COVID would be found, it would mean that probably more than 12,000 new cases of ME would be found in Serbia in the near future. This is a study from Germany where they looked for the association of ME and long COVID, looking at endothelial dysfunction and other biological markers. And they found that around 50% of patients with long COVID fulfill the criteria of ME. So around 50% of patients with long COVID would have ME CFS. What is the prognosis? So the prognosis of long COVID happily is better than the prognosis of ME. If they are in children and adolescents, the prognosis seems to be very good. This is a very good thing. As a whole, over 80% seem to recover at least in some degree within 1 year, but around 20%, perhaps less, perhaps more, have symptoms that last for over 18 months. So when we combine all studies, it seems that perhaps we come to the same figures as Komarov and others, that perhaps around 10% would develop ME. We don't know whether this is true because we have vaccinations, and there is now several studies showing that the vaccinations for corona is reducing the incidence of long COVID, and probably it reduces also the incidence of ME after long COVID. So in conclusion, when we are talking about the similarities with the long COVID and ME, first we should make a difference between post-intensive care units, so PICS, post-hospital COVID-19 condition. It has a worse prognosis than long COVID. And it is more common in the older age group, so that is more common in the elderly people. But most cases of long COVID begin after milder forms of COVID-19, and they are most common in the younger groups, which make it problematic because they are students or they are in the working age population, which of course may cause a lot of economical problems. As a whole, the incidence of ME CFS after long COVID is around probably less than 10%, but that means that the incidence after COVID may be around 1% or perhaps less. But anyways, it's a very, very large number. Finally, I want to end by this, that in the same way as we heard from Ina and others, that it's a pity that it's a very good thing that we now study a lot for long COVID. And the research on long COVID will help us to understand ME. Happily also the research on treatments in long COVID may work also in ME CFS. So probably we benefit. It's a little bit ironical on the other hand that ME is now better realized than before. And also that still many people don't believe that the long COVID exists, and even more, they don't believe on ME. But it is about the same thing, a lot of similarities. Thank you very much.
Thank you so much, Professor.